Good morning, staff of AMH Medical Center, and welcome to your annual training. Today, we will be refreshing our knowledge of procedural coding from the use of CPT, Evaluation and Management Service Guidelines, Category 2 and 3, modifiers, and Medisoft, which is the new software that's going to be implemented into our office. So let's get started. What is a DRG? A DRG, or Diagnosis Related Group, is a statistical system of classifying any inpatient stay into groups for the purposes of payment. The DRG classification system divides possible diagnoses into more than 20 major body systems and subdivides them into almost 500 groups for the purpose of Medicare reimbursement. ICD-9 is a set of codes used by physicians and hospitals to indicate diagnosis for all patient encounters. These diagnosis codes consist of 3 to 5 numeric characters representing illnesses and conditions. E codes describing external causes of injuries, poisonings, and adverse effects. And V codes describing factors influencing health status and contact with health services. ICD-9 consists of 3 volumes. Physicians use volumes 1 and 2 only to assign diagnosis codes. Volume 3 is used by hospitals for reporting inpatient procedures and resource utilization. How does the ICD-10 diagnosis code set differ from the ICD-9? Did you know that the ICD-9 code set was about 36 years old? Take a moment and think about the healthcare landscape 36 years ago. In addition to being old and outdated, ICD-9 isn't detailed enough to describe patient diagnosis and modern medical services and procedures. It uses antique terminology, and it produces incorrect, limited patient data. With ICD-10, the code set has been expanded from 5 digits to 7 digits, and as of the latest version, there are 68,000 existing codes as opposed to 13,000 in ICD-9. The terminology has been modernized and has been made consistent throughout the code set. It also enables reporting of laterality, reflecting the importance of which side of the body or limb is being evaluated. ICD-11 is now being developed through a continuous revision process and will be finalized in 2018. What are CPT codes? CPT codes, or Common Procedural Terminology codes, describe the physical procedures that healthcare providers perform when patients come in for an office visit. There are 3 CPT categories. Category 1 is most common and widely used, and it describes most of the procedures performed in hospitals and offices. Category 2 codes are a specific set of codes used for performance measurement. They are included in the CPT manual to help decrease the need for record requests and chart reviews. These codes make it easier for organizations in the medical industry to track performance. Category 3 are temporary codes, and they're used to describe emerging and experimental technologies, services, and procedures. Sometimes it's necessary to include a modifier with the procedure code. What this does is change the meaning of the procedure code. This helps the insurance company understand the service that was provided at the office visit by including additional information. Modifiers are also sometimes necessary to make sure your claims are paid in full. The morphology code records a type of cell that has become neoplastic and its biologic activity. In other words, it records the kind of tumor that has developed and how it behaves. A major component of many doctors' visits are E&M, or Evaluation and Management Services. These codes describe the physical examination components of a doctor's visit. There are many factors to consider when assigning an E&M code, like the place of service, type of service, and patient status. For example, in an office visit, it would need to be determined whether you are a new patient or an established patient. In a hospital setting, it would need to be determined whether this was your initial or subsequent visit. And there's also different levels of consultations. There are 7 categories for billing for E&M. History, examination, and medical decision making are key factors. There's also counseling, coordination of care, nature of presenting problem, and time, which can also be a key factor if the time is over 51 minutes. This is an example of a patient's chart. And here are the diagnosis and procedures for this patient. Last but not least, we all know what type of form this is. This is the CMS 1500 form, which is a standard paper claim form to bill Medicare fee-for-service contractors when a paper claim is allowed. Instead of doing things manually, we will be using a new software called MediSoft, which is the most popular choice for medical billing. This software will be used for patient intake, scheduling and billing, and revenue management. And it is also ICD-10 ready. Congratulations, you have just finished your procedural coding annual training.